In health news tonight, a group of pediatricians have removed a ban on breastfeeding for those with HIV. A new blood test can help to detect strokes, and updates on fertility treatments for breast cancer survivors. I'm Cameron Bowden, and I'll have more on these stories later in the broadcast.
Newsline. Health.
A group of U.S. pediatricians have finally reversed a ban preventing people with HIV from breastfeeding, as long as the person with HIV is taking medications to suppress the virus. The American Academy of Pediatrics released a new report that overturns the 1980s-era ban, which was adopted at the start of the HIV/AIDS epidemic. A pediatric expert at the University of Colorado, Dr. Lisa Bwogi, says that the report notes that routine medication can reduce the transfer rate of HIV to below 1%. These drugs, called antiretroviral therapy, doesn't eliminate the possibility for HIV to be transmitted through breast milk, but greatly reduces it. Our next story, a new blood test might be the best way to determine what type of stroke someone is experiencing. When a stroke hits, time is of the utmost importance as neurons begin dying within minutes of a stroke occurring. However, a vital part of the process is identifying the type of stroke being experienced, which can take some time. Researchers at Brigham and Women's Hospital in Boston have reported that a new test they developed can determine with a high certainty whether a patient is experiencing a very lethal type of stroke called a large vessel occlusion. If an LVO is determined from the test, it allows doctors to begin a surgical process called mechanical thrombectomy to remove the clot from the large artery, which feeds into the brain. Finally, a new report has found that fertility treatments like in vitro fertilization do not boost the chances of a tumor reappearing in survivors of breast cancer who carry the BRCA cancer gene. This stems from a fear that doctors had that breast tissue can be sensitive to increases in hormones, and assisted reproductive techniques tend to lead to boosts in estrogen. According to the lead study author Matteo Lamberti, these findings allow discussing the risks and benefits of using ART to preserve chances of having a baby following the completion of anti-cancer therapies. The Italian study finds that those carrying the BRCA1 or the BRCA2 genes are not at risk of recurrent breast and ovarian cancers when undergoing fertility treatments. For your Newsline Health Report, I'm Cameron Bowden, WRHU.